Over 1 million Georgians are uninsured. Nearly 300,000 of those fall in the health care coverage gap. It's time for Georgia to expand access to quality and affordable health care. 40 states and D.C. have already expanded Medicaid to 138% of the federal poverty level. Georgia has not. Those 300,000 Georgians are hardworking farmers. They're part-time hourly employees. They're gig workers. They're veterans. They make too much to qualify for traditional Medicaid, but don't earn enough to buy a plan on the open marketplace.
So there are several instances of the men and women we work with, the veterans we work with, who want to create their own business, who want to create their own entity. And some of the barriers to starting that or doing that journey includes a lack of healthcare options or healthcare for themselves or their family. So I think we're missing out on an opportunity to have some amazing small business owners, some amazing small businesses that could really be impactful in our area, in our state, because these men and women cannot afford healthcare coverage to provide for them and their family. Those dreams are delayed or deferred, so they go to corporate that is able to provide healthcare services for them. I believe that closing the coverage gap through Medicaid expansion is super valuable for veterans, because so many come back or transition out of military service and they do not yet have a job that has the healthcare benefits that they need to provide for them and their family. So there's a period of time where they are in this transition and life is going to happen. They are going to need healthcare. It would be awesome if the state could come together and say, hey, let's ensure we're taking care of the guys and girls who have provided for us, who have kept us secure. I think it'll be super valuable if we can close that gap.
I'm a self-employed masonry contractor. I started toting block and brick for my dad when I was 13 years old. During summer when we were out of school, all the school vacations, I was on the job site with my dad, so that's what got me into being a mason. He trained me. I love interacting with customers. I love the freedom of being my own boss. I love to be able to relay a lot of stone, and I love to be able to stand back when I'm done with something and see what I've created with my own hands. The biggest challenge that I've had to try to get insurance is the good insurance is so expensive, $600-700 a month, private insurance, which it is backbreaking to cover that kind of extra cost when you're not anticipating in life. And the policies that are inexpensive, the $250-300 a month policies, are the ones with $10,000 deductibles, and they only cover certain doctors. You have to stay in the network. They only cover certain medications. They only cover certain things that the doctor wants to do. So there's really no point. You have such a huge upfront cost that it's hard to make up that deductible.
Because we haven't expanded Medicaid, $3.6 billion of Georgia federal tax dollars leave here and pay for health care coverage in 40 other states. If we expand to 138% of the federal poverty level, we can close the coverage gap and benefit Georgians. Reducing our uninsured rate is not just good health care policy, it's good fiscal and economic policy. A recent economic impact study shows that it'll create 51,000 jobs, increase our economic output by $9.4 billion annually. And we have data by county as well, showing county commissions and city councils and chambers of commerce what the impact is to their local community.
The great thing about this organization is they've done the research, they have the numbers, and it's legit. It's not one-sided. It's not hey, I feel this will happen. No, they've ran the research, and it truly helps to enhance our community.
And there are more benefits. By closing the coverage gap, we can put money back in the pockets of Georgians, reduce healthcare premiums for all of us, and help our rural hospitals. Losing a rural hospital costs local jobs. It's less access to care and a loss of economic development opportunities for years to come. But if we expand Medicaid and close the coverage gap, we improve reimbursement rates, we reduce uncompensated care in Georgia communities, we incentivize primary and specialty doctors to rural parts of our state, improve maternal and mortality rates, and generate savings in child welfare and local law enforcement budgets. Our statewide Bridge Georgia Healthcare Coalition made great progress getting the first ever Medicaid expansion here under the Gold Dome. And polling results show the majority of Georgians support expansion. Closing the healthcare coverage gap is a good idea. It's good health policy, fiscal policy, and economic policy. It just makes good business sense. With any presidential change or shift in congressional majority, we can expect to see a shift in priorities at the federal level, and that means a potential for Medicaid-related changes. However, what has not changed is Georgia's uninsured problem. Year after year, Georgia ranks among the top 5 states in the nation for the most uninsured. We have nearly 300,000 hardworking Georgians who fall in the healthcare coverage gap. And Georgia could see that gap increase significantly, considering approximately 700,000 Georgians currently receive health care subsidies that are set to expire in 2025. If Congress doesn't extend those subsidies, a significant portion of that 700,000 could find themselves once again uninsured and Georgia's coverage gap worsening. Regardless of what any future federal changes look like, Georgia must expand eligibility to 138% of the federal poverty level. Bring home the $3.6 billion in federal tax dollars we're paying to serve our state's healthcare needs, not fund healthcare for residents in the 40 states that already expanded. And we need to maximize all healthcare benefits and funding available to us under the new administration, whatever those may be, because Georgia's lack of access to affordable quality healthcare coverage is still a problem, and it's a problem that impacts and drives up costs for all of us. Here's how you can help. Georgia's the #1 state for business. Now let's make it the #1 state for access to quality, affordable healthcare.